My name is Dr. Debby Feinberg. I'm an optometrist practicing in Birmingham, Michigan, and my specialty is helping patients with traumatic brain injury. About 6 years ago, I began working with a physical medicine and rehab doctor who identified a group of patients she thought that I could be helpful for. These were patients who'd had head injuries from auto accidents, falls, and I was able to help these patients by identifying an eye alignment condition that responded to treatment with corrective eyeglasses lenses to actually coordinate the images. While the patients weren't aware of it, they were actually seeing shadowy vision by trying to coordinate their two eyes, and in doing so, they were actually experiencing symptoms that we have all learned to call post-concussive. They had headaches, dizziness, nausea, anxiety, imbalance with walking, and light sensitivity, as well as difficulties with reading. We were successful over a period of time of 6 years in helping close to 700 patients over that period of time, and it was all being done with eyeglasses. Not knowing that I could help a patient with a blast injury, I had my first patient a couple of years ago who reminded me very much of a patient with a head injury from an auto accident. And this patient responded beautifully to the prism. The prism is actually built right into the glasses. In building it in, what we're doing is we're coordinating the images so that they no longer see the shadows, so that the eye muscles no longer have to work as hard to coordinate the images. It calms their body, it reduces their anxiety, and reduces their symptoms as well. Recently, I had the opportunity to meet a soldier who'd come back from the Iraqi war from a blast injury, and he was being presented to the Brain Injury Association conference. He was someone that we were meeting to see if we had any answers to his symptoms of headaches, dizziness, and imbalance with walking. I asked him to come see me if he could, and I would like to try to help him. He was able to come in October, and he had a cane with him, and his biggest symptoms were headaches and dizziness and shadowy vision, difficulty with walking and imbalance. He was treated with his first pair of glasses, and within 5 days, he no longer needed his cane for walking. He was more sure-footed, he knew where the ground was, and he felt much more comfortable in open spaces. It's now 4 months later, and he describes himself as being 90% better. He feels that he can now read without reading causing him headaches. He no longer is nearly as nauseous or dizzy. And I'm very happy to report that this is now a population that, while I didn't know exactly if they were similar in a classic post-concussive sense, in fact, they are responding. I've seen another soldier who I learned about from a radio show, and I gave her a call and asked her again if she could come. I would like to try to help her. And she also was in the war about 5 years ago, and her injury was from a blast. So people ask me, how soon can you help these patients? I can often help them as early as 3 months after their injury when it's a mild concussion. And there doesn't seem to be a limit to how far out their injury can be. They can be out 20 years after an auto accident, and they can still be helped by correcting this misalignment of the eyes. In terms of how much better patients can get, we often ask them to tell us in a percentage, and usually they'll describe feeling 70% better to 80% better in improvement in their symptoms within 3 eyeglass prescriptions. In terms of what are the different things and what are the symptoms that these patients have, I'll just give a list again. They have headaches, they have dizziness, they have nausea, they have imbalance with walking. They don't feel like they know where the ground is. They're very unsure of their footing. They have difficulties with reading, and sometimes they even have facial pain. And this is, and I'll use my hands to describe, if my 2 eyes are not working together, they're trying to coordinate the images, and in doing so, that's what's bringing on those headaches. But then they can't sustain that focus, so the eyes sort of pull away, and that creates their dizziness. So they often are going in and out of focus, and that is causing their symptoms of dizziness and disorientation in space. And I'm thrilled and excited that this population of soldiers returning home have a chance to be helped by something like a pair of glasses. I will say that in some cases, when these patients were previously treated with medication for their headaches, in some cases they no longer need those medications. So I call the eyeglasses their new medicine, and they wear them from when they wake up in the morning until they go to sleep at night. And modifications are made over a 3-month period of time. As their eye muscles relax, sometimes I need to adjust the prescription. Dan had, this patient I'm referring to, I believe he had 2 changes to his prescription to bring him improvement. If you'd like to get more information about this work, please feel free to visit the website for the office. It's www.vsofb.com, and it stands for Vision Specialists of Birmingham. The phone number is 248-258-9000. If you think you have symptoms that I've described today, you can go to the website and take an online test and complete it online, and then someone will actually get back to you with a phone call with your results.